Okay, so again, this week I don't have anybody to help me out with the assessment, but that's okay because I have my dear friend Mr. Frog here, the only stuffed animal I could find in the house, so bear with me. So I would walk into the room and I would say, "Good morning, Mr. Frog. My name is Eileen and I'm going to be your nurse today. I'm going to perform a focused assessment of your nose, mouth, throat, and lymph nodes. This will involve inspection and light palpation, so let me know if you have any type of discomfort." So then I would perform hand hygiene, I would wash my hands, and I would verify the patient. So I would look at his little wristband, and I can tell it's Mr. Frog, and his date of birth is January 2nd, 1932. And so then I would next ensure privacy. So I would make sure that I would close this curtain here so he has some privacy. And I would ask him if he's doing okay. "Mr. Frog, are you comfortable?" Okay, great. So then next I would observe for symmetry, deformities, swelling, or lesions. And as we can see here, his face is perfect. There's no deformities in the nose. There is no deformities in the ears, and my cat wants to get involved. And I would have him open up his mouth, and then I would use my pen light to check inside and see if I seen any type of abnormalities or lesions in his nose or throat, which I do not see. The nose appears symmetrical with no deformities or lesions noted. Next, Little Miss Nosy. I would inspect the nasal mucosa and check the septum, and it looks good. It's pink. I would tilt the patient's head back and inspect. The mucosa looks pink and moist. The septum is midline here. Without any perforation or deviation. Looks good, Mr. Frog. So then I would close one nostril here, and I would ask the patient to breathe in, and then I would close the nostril here and ask the patient to breathe in, which he did great. The normal findings would be pink mucosa, midline septum, and patent nares. Abnormal findings would be redness, swelling, polyps, deviation, or obstruction. As far as the mouth and throat, I would check his lips. His lips look great. And his lips are pink and moist without lesions. Oral mucosa is pink and moist. Gums are intact without any swelling. Let's see. Or bleeding. The teeth are very clean and intact. Then I would ask the patient to open up wide, say "ah," and then I would see that the uvula rises midline, the tonsils are small without redness or exudate. So normal findings would be pink, moist mucosa in the midline of the uvula. Abnormal findings would be lesions, swelling, exudate, or tooth decay. And then I would check the axilla area to check the lymph nodes. So I would check here, and I would palpate to see if I feel any type of nodules that are either painful or unpainful. No pain, no pain. And then I would ask him to lift his arm, and then I would feel inside the inside here to feel the nodules, see if there's any nodules. Any noticeable nodules should be small, mobile, soft, and non-tender. Abnormal findings would be enlarged, hard, fixed, matted, or tender. And that's it for Mr. Frog. He's doing great. You're in great health, sir.